Hello everyone, my name is Brian Matway and thank you for watching my presentation which I have titled Google Medical, Self-Diagnosing in the Information Age. To begin my presentation, I would first like to talk a little bit about myself. My name is Brian Matway, I'm 38 years old. I'm currently an RN working at Sparrow Health System in Lansing, Michigan. I've been working at Sparrow Hospital for a little over 9 years. Before that, I was a paramedic working in the field on 911 calls and also at the hospital as a critical care medic doing transports to and from hospitals in the critical care units. My wife, Courtney, is also a nurse who works in the pediatric intensive care unit at Sparrow Hospital. She has been a nurse there for 13 years. She has worked in the same department since her beginnings at Sparrow Hospital. We have been married for almost 2 years now and just recently welcomed our newborn son, Landon James, to our family. Spanning my career working in medicine, which has been close to about 15 years, I have worked in the pre-hospital, the emergency, and the inpatient setting. In all of the settings, I have come across patients who have come to me with complaints of saying, I think I have fibromyalgia, or I think I have HIV, or I think that I might have Parkinson's. Where does this new information come from? Almost 100% of the time it comes from people saying that they Googled it and that the symptoms that they had currently matched up with things that they Googled on the internet. This newfound type of information seeking has been creatively coined Cyberchondria. The term Cyberchondria uses the prefix cyber, of course referring to the internet, and the word hypochondriac, which of course is someone who thinks that they're sick all the time in unfounded reasons. The term was coined in 2008 by researchers from Microsoft named Ryan White and Eric Horvitz. They did the first extensive study looking into cyberchondria and then coined and defined the term as an unfounded escalation of concerns about common symptomology based on review of the search results and the literature online. The dispute in regards to my final project is between the case of obtaining readily available information versus using that information responsibly. Anyone can use a Google search bar, but not anyone can or has gone to medical school or nursing school. The technology today is light years beyond what it was only a few years ago. It will only continue to advance. Information seekers and, more importantly, information medical seekers are here to stay. However, how we use that information matters. The consequences of improper use can be detrimental to personal and public health, strain the doctor-patient relationship, and develop a mistrust of the medical establishment. If there is one word I could take from the title of my final project, it would be diagnosis. The main point and counterpoint argument that I typically have with a lot of my patients is they say that, I'm educated, I went to school, I can read this information, I can understand this information. But what they don't really understand is that what a diagnosis means and what it means to make it involves so much more than just typing some words into Google. Doctors must go through a lot to develop an official medical diagnosis. By definition, a medical diagnosis is a label given for a specific medical condition or disease identified from the signs, symptoms, a detailed medical history, and various diagnostic procedures such as blood work, x-rays, CT scans, and etc. Long before physicians have the opportunity to begin diagnosing patients, they must spend at least 3 years mastering the human body and its functions in a normal state. They do this by constantly studying the 4 pillars of the human body. They are anatomy, which is the structure of the body, physiology, how the body works, pathology, which is what can go wrong with both the anatomy and the physiology, and psychology, the thoughts and behaviors. Once physicians are proficient in all of these areas, they can then begin to practice issuing diagnoses under medical supervision. Beyond inducing a panic state and an attitude of worst case scenario, there are many other reasons why using the internet for medical reasons could be potentially harmful. Take, for example, the 45-year-old gentleman that I picked up in the ambulance approximately 8 years ago. I arrived at his house with the dispatch information of severe chest pain. When I inquired to when his chest pain began, his wife informed me that he had gotten progressively worse over the period of 6 hours, and she had been trying to convince him to go to the hospital all day long. When I asked the man why he waited so long to seek help in the matter, he told me that he only had chest pain, and when he researched heart attack on the internet earlier in the day, the results were chest pain, nausea, vomiting, numbness and tingling, arm pain, and malaise. The man then went on to explain me that because he only had mild chest pain and it seemed to come and go at the time, then he didn't think that it was a heart attack. It was only attributed to some gas buildup that he had substernally. When I performed an electrocardiogram on him, which views the electrical activity of the heart, I was horrified to find that the man was in a full-blown heart attack. Thankfully, me and my partner were able to transport the man to the hospital where he was able to have an emergency heart catheterization, saving his life. Had he waited another half an hour, say, his Google search might have killed him. Beyond potential physical complications, people may be placing financial well-being above health when self-diagnosing on the internet. In a country where the numbers of unemployed and uninsured are rising every day, people are looking to other options for health care. The Pew Research Center, based in Washington, D.C., is a nonpartisan American think tank which studies American polls and search data accumulated from the internet. In 2013, it found that almost 60% of Americans look to the internet when it comes to healthcare. While this type of research could possibly be used as a guide to formulating a plan for uninsured families, it is risky and potentially debt-producing path to take. The internet is filled with scammers and cheats and liars who do not care if you spend $100 on a fake cholesterol-reducing medication, money that might have been better spent on actual FDA-tested, recognized prescription medication. Concerning the overall opinion of the general public, it is not my belief that people believe physicians and medical professionals are unintelligent. Personal health, above all things, is very important and should not be taken lightly. Using the internet for medical information is a double-edged sword. Convenience and speed are attributes that may improve life in certain aspects. However, this is not always true in regards to medical health. While a computer monitor may seem like a window into an endless ocean of valuable information, we need to realize that understanding and using that information responsibly can prevent us from actually drowning in it. So, in other words, when asking Dr. Google, "What's wrong with you?" make sure he went to medical school. Thanks for watching.